Looks to boost technology to connect rural hospitals and patients to high-quality care they need while also keeping them in their local communities. RFD-TV's Sarah Mock reports on the issue in today's rural healthcare segment.
In the wake of a recent decline in rural hospitals, the FCC is rolling out $100 million to support organizations connecting patients and doctors digitally.
And one of the things that telehealth has as a tool, as a benefit to rural hospitals, is the ability to keep those patients there in that hospital. We have too many unnecessary transfers in our health system nationally, and telehealth creates a link to specialty practice and consults and an increased capability in learning.
And there's evidence investment in this technology really works, not just to treat patients, but to save and revitalize rural communities.
That town was all but dying. The healthcare center, the Copper Queen Hospital, was going out of business. They were operating in the red and they could not continue with the funding. They put in their first telemedicine system probably now 9 years ago, and in the first 6 months, the system saved $540,000 in unnecessary transports. Because in the past, if you presented with a potential heart attack, you immediately got airlifted to Tucson.
Experts are enthusiastic both about the earning potential of telemedicine solutions for at-risk rural hospitals and about the possible cost savings for patients and providers alike. With healthcare accounting for nearly 20% of U.S. GDP, treating patients over video chat and keeping them out of emergency rooms can lead to major cost savings. And companies looking to address this issue come from every angle. One company, a Texas startup called Cloud 911, is connecting mental health patients to care directly through emergency phone calls.
Really start to break that vicious cycle of mental health patients being admitted to ERs, being admitted to jails. It's actually about a $32 billion problem in the U.S. right now. They're tackling that head on. They've already shown a measurable decrease in ER admissions, jail admissions, at 800% ROI to the counties that they partner with.
The FCC's Connected Care pilot program will support these kinds of telehealth services across the country, with a particular focus on low-income Americans and veterans. The commission is set to vote on related projects in early August. For RFD-TV, I'm Sarah Mock in Washington.
Well, the new FCC funding would be in addition to its current provision of more than $500 million annually that promotes broadband adoption for rural medical facilities. And rural health care in the Midwest